Denise, you can go ahead.
All right. Hi, everyone. Let me know if you're hearing me clearly. Are you
Yeah, we
hearing me?
can.
All right, great. So welcome, everyone. Welcome to another week of PSA, where we get psyched and stay psyched. All right. So it's really good to have you participating with us in another session. And again, I would love to see some faces, but until then, welcome everyone. And I welcome our guest speaker is here as well. Right, we'll be having a guest speaker today, Miss Nickiesha Passard. She's a licensed associate clinical psychologist, and she'll be talking to us about depression and mental health screening. But before we get into all of that exciting stuff, we will have an icebreaker. And before the icebreaker, I'm going to ask Najani, our president, to lead us in prayer at this time.
All right, thank you, Denise. So if we can just bow our heads in prayer. As we come into your name again, Father, we thank you for bringing us together as a PSA family to have productive meetings when we can share ideas and, how persons who are, professionals to share with us, Lord God. Lord, we envision ourselves as budding psychologists, Lord God. So we want to ensure that we have all the requisite knowledge that we need, in order to enter the field. We want to thank you, Lord Jesus Christ. We want to pray that we have a productive meeting, that each and every person here today takes away something from it that can benefit their lives, Lord God. So I pray for a productive meeting, Jesus Christ. In a wonderful and awesome name I pray. Amen.
Amen. All right. Hi, Jaleel. All right, as the person is commenting in the chat, amen. All right. Okay, so we're going into some icebreakers now just to warm us up. And while our events coordinator, Tasha Gay, is setting that up, right, she's ready? You ready, Tasha? All right, well, she's finalizing her setup and all of that. Just want to hear from you all in the chat, or if somebody would like to open their mic briefly, just let us know how you are doing. I know this week some persons are still doing exams. I hope they went well for you, and for those who may still have some exams, I hope that they will go well. And just encourage you all to really do your best, because that is what is really important. Do your best. I'm not seeing anything in the chat. Everybody's okay? All right, I guess everyone is fine. You can go ahead, Tasha again. Really important.
All right, everyone. What is happening? You guys hearing me?
Yeah, I'm hearing you.
All right, guys. Welcome again, as Denise had extended. Welcome to everybody. I just want to welcome you, and I hope that you're having a great day. You're seeing my screen, Denise?
Yeah, I'm seeing your Zoom screen as well.
Okay. All right. So, what you see now?
I'm seeing your PowerPoint slide.
Okay. All right, guys. So I'm going to need you guys to open your mics and talk to me a little bit, because we're all in this together, right? All right. So, little icebreaker for today is think alike. what we'll be doing is that we know that a little phrase under the bottom says there's nothing like great minds. So we know that we all have great minds. I'm pretty sure that this little icebreaker will be all thinking alike. All right, so what you'll do is that you'll get 30 seconds to think of, I'll give you the category or I'll give you the topic, and you get 30 seconds just to think about the person. So the first one is famous psychologist. So you're going to get 30 seconds. You're going to get 30 seconds to think about three top psychologists. After you do that, um, based on based on what everybody gets, then that would be your score. So if two persons have it, you get 2 points. Everybody understanding so far? Yes, no, maybe so.
Can you repeat the instructions, please?
All right, so the instruction is like, all right, so I'll give you, so the topic is, the whole thing is think alike. So the topic is famous psychologists. So what you'll do is that you will get 30 seconds to think of three psychologists that you think everybody would write. Understanding so far?
Okay, I get it.
So let me see those who will be participating. So I need like some participants. Somebody.
I'm not seeing any messages in the chat. Is there anyone who would like to participate? Albert?
Anybody would like to
Be a
participate?
participant.
Okay.
Joshua says his Wi-Fi is poor. If you could repeat the instructions.
Anybody else? Anybody else?
What's again?
Yes, I'm here.
Yeah, could you repeat the instructions for Joshua?
All right, so the instructions is that I'll give you a category and you will think of, so let's say like we have famous psychologists, you think of three psychologists. Think of three psychologists that everybody would want to write.
I'll try.
Anybody?
It's a good way to test our memory, but I want some other persons to join me.
Yes, so we need participants, guys. Only Denise.
Jolene said Sigmund Freud, Dave Skinner, Jean Piaget.
We're not ready as yet, because I'm still waiting on persons to actually say that they'll participate.
I guess Jolene, you're going to participate? So? Yeah, she said it.
All right. So just go ahead with those who are willing to participate. I'm assuming that persons will just put their thing in the chat. All right, so the first one is a famous psychologist. It's not a lot, guys. So your 30 seconds begin now.
I seen your Zoom screen. Are we supposed to be seeing the slides now? Okay, I'm seeing the slides now. All right, so let me verbalize mine then. Sigmund Freud, Ivan Pavlov, and Carl Jung. You hear Anastasia? Oh, you're
I'm hearing. Alright. So I see in the chat. So guys, you have to utilize your microphones because it's kind of hard for me to be sharing and then I have to be going back to the chat. So if somebody could really assist me in terms of the chat, that would be really good.
Alright, I will help.
Okay.
So Jolene had said Sigmund Freud, Dave Skinner, Jean Piaget. Jabari said Maslow, Piaget, Pavlov. Eureka says Carl Rogers. Joshua says Ivan Pavlov and Lev Vygotsky.
Alright, so for anybody that have Pavlov, that's the only person that got two. Everybody else got one. Alright, so moving on to the other one.
No, but two persons have Pavlov. One person has Carl Rogers and Lev Vygotsky.
Alright, so just look in the chat and grade accordingly. Alright, next one, moving on to Jamaican artists. So 30 seconds begin now.
Alright. Coming in. So Sharika says coffee, Bob Marley. Javaria says Spice, Buju Bantan, coffee. Jolene says Buju, coffee, Bob Marley. Sharika says popcorn. Najani says Tessa and Chin. Colleen says Marcia Griffiths and popcorn. Najani says Shaggy. Sharika says Buju again. Shada Chronics. Whew.
Nobody in the red cartel.
Aye.
Chronics, Coffee, Lila Ike, Bob Marley, Tommy Chin, Damian Marley. Alright.
Alright, that sounds like a lot.
Yeah.
Alright. Next one, things that causes depression. 30 seconds begin now.
Alright, as a school cause depression, chemical imbalances, personal issues, stress, social distancing, UE. Wow. Toxic social environment. Yes, we saw technicality. Toxic social environment.
That's like a lot. Alright, next one.
Family or some personality. Okay.
Next one, food on campus.
Patty. The virus says Patty. Sharika says KFC. Patty shop. Bad dog. I'm guessing that is hot dog. Mad dog. Cheese patty. Some persons have never been on campus. But then cheese.
Alright, next one. Alright, so the next one is Jamaican athlete.
By the way, I've lost track from long time, so
Yeah, me
fun,
too.
guys. This is just for fun.
Alright, so the next one is Jamaican athlete. You can just post your comments in the chat.
Oh, the chat is blowing up. Alright. Usain Bolt, Safa Powell, Shelley and Fraser. Usain Bolt, Shelley and Fraser, Elaine again. Who's SFP? Nesta Carter, Michael Frater, Elaine Thompson Hera, Johan Blake, Elaine Thompson Hera, Usain. Barry Powell, Johan Blake, Nickel Ashmead, Veronica Campbell Brown, Sharika Jackson.
Alright, that sounds like a lot. Alright, so the last one
right, that's one.
Jamaican fruit.
Mango.
I
Aki.
can't stumble.
Colleen says Aki. Wait, oh, I only see one response. Jamaican fruit. So, is that a fruit though? Tomato is a fruit. It doesn't have seeds. Guava, sweet sap. Jolene says mango, naseberry, pineapple. Jada says mango, pineapple, guava, jackfruit. All right, mango is a common one. Guinea. Colleen always coming with something that nobody else mentioned.
Okay. All right, guys. So that was basically the little icebreaker for today, and thank you guys for participating. I'll now hand back to Denise.
All right, thanks, Sasha. Thank you for that activity. It caused some nostalgia for me, but it was fun. Thank you. All right. At this time, Javario is going to introduce our guest speaker for today. Javario.
All right. Thank you, Denise. All right, good afternoon, everyone, and welcome. And welcome to any guests that we have. So I'll be introducing Ms. Passard, who is a licensed associate clinical psychologist who resides and practices in Jamaica. She specializes in treating adults and adolescents with a variety of psychological concerns, utilizing a wide range of holistic orientations and techniques that are tailored to meeting the unique needs of each client. Ms. Nickiesha Passard is also a lecturer at the University of Technology with a postgraduate diploma in education and training from the Vocational Training Development Institute, and she was also the past president of the Psychology Students Association. Her passion for mental health care has led her to conduct research and public education workshops in numerous areas. She has also published in the Health Education Journal, focusing on using faith-based organizations to promote mental health education for the underdeserved populations in Jamaica. Ms. Passard is guided by the principle: your mind is like a GPS. It can take you anywhere you want to go, and past pain, hurt, and disappointment doesn't have to define you. Instead, use it to refine you. Ladies and gentlemen, please help me welcome Ms. Nickiesha Passard. Ms. Passard, the floor is now yours.
Okay, thank you so much for having me, and thank you for that wonderful introduction. And I'm going to share a screen. I did not know you would have done an icebreaker, but I tend to start off my presentations with a little icebreaker as well. So I'm really hoping that more persons will actually participate. So this time I'm not going to ask persons to just volunteer. What I'm going to do is just like persons can just open their mics or raise their hands or just type in the chat, and I'd need help to monitor the chat. All right, so are you ready?
I'm ready.
All right, great. Okay, slideshow from beginning. All right, I only got one. I'm ready. So I don't know if you've ever seen school challenge quiz where like when it's the buzzer section and it says like name the artist on the screen or something like that, but this is not how it's gonna go. You'll have to listen to the audio and then you'll have to try to identify who the artist is. You think you understand?
Yes.
All right, so let us go.
Right. Someone said yes in the chat and somebody says ready. Colleen says ready.
All right. All right. So you have to listen carefully and then you just tell me who you think the artist is. I believe I can, I will. No holding back, no. Do we know?
Elaine.
Hold on, then open your mic. I see it in the chat.
I believe I can, I will. No. All right, so that's actually correct. That was Aline. All right, next one. Wayne Marshall. Wow, you guys know songs, all right? Sorry. Correct. Next. Let's see if you know this. Okay, so the person who said Tessan, that's correct.
I'm away.
Agent Sasko.
I'm on the sun.
All right,
I'm away.
great. Okay.
Song to the people when I think of where I'm coming from. Looking
Correct.
song to the people when I think of where I'm coming from.
How about that one?
Put up a fight, we got to be ready.
I don't
Doing-
think responses yet.
Okay, let me continue. Guys, all right. Okay, so I'm happy I got your blood's pumping, your mind is ready. But based on the songs that you heard just now, is there a theme you're picking up based on the type of songs? What do you think would be like a recurring theme? What were some keywords that jumped out at you?
Resilience.
Resilience. All right, great. And resilience or resiliency is needed whenever we're going to try to combat any form of mental illness or depression. All right, so today I'll be talking about depression and mental health screening. And so by the end of this session, we hope that you will be able to define what mental health is, as well as mental illness, explain the cause of mental illnesses, also be able to identify types of mental disorders, discuss signs and symptoms of depression, explain the role of stress in mental health conditions, as well as identify different mental health screening tools. So, mental health. This is something that we use a lot and say, okay, I'm mentally healthy, I'm okay, right? And we use mental illness, especially in our field. We hear it a lot, but do we really understand what mental health is? So a lot of us understand what physical health is, but not a lot of us understand what complete mental health involves. So it includes emotional, includes psychological, as well as social well-being. And mental health affects how we think, how we feel, as well as how we act. So it also helps to determine how we handle stress, how we relate to others, as well as the choices that we make. And it's very important at all stages of life. So if I was supposed to ask you, are you mentally healthy? What would you say? Do you think yes, you are? Do you think emotionally, socially, holistically, you are well? Spiritually, do you think you are well? Right? Are things affecting how you feel? Are things affecting how you think? Are things affecting how you act? Let me hear from you. Do you think? You could put it in the chat. You could say it out loud. Do you think you're mentally well, or you're healthy mentally?
Most of the time.
Most of the time. So right. So what happens is that it exists on a continuum. So nobody's always going to feel 100% all the time, because life keeps happening. Now that we have an understanding of what mental health means, what does mental illness really mean? So mental illness is a brain dysfunction that's affecting different aspects of our lives. So just like when we are sick, and if it is a tummy ache and physically we're feeling symptoms and we go to the doctor, right? Persons who are mentally ill, or persons who are not mentally well, what happens is that their thinking process may be distorted, their feelings, their actions, their different aspects that may be impaired. So when we think about perception, what we're thinking is that if a person has a mental illness, these people will experience the world, or with their senses, it may be impaired in some sense, depending on the mental illness that they have. So some persons may have delusions, some persons may have hallucinations, some persons may be seeing things or hearing things differently from how a person who is in the normal range of functioning is behaving. Now, thinking may also be impaired. Maybe it's a case where your thoughts, they're coming too quickly. Maybe your thoughts are poorly organized. Maybe you're just confused a lot of the times. Maybe your thought process is actually very illogical or irrational. When we talk about mental illness impacting our mood, we're talking about just your feeling. Some persons may have mood swings, persons may just feel sadness, persons may just feel anxious a lot of the times, and persons may actually have manic episodes. So when we talk about manic episodes, it's almost as if they're behaving in a way that it's very erratic. We can't understand what is going on. Maybe they're saying things or doing things that doesn't make sense to a person who is in the normal range of functioning. When we talk about behavior, we're saying mental illness can actually impact how you behave. So maybe you're behaving in a bizarre way. Maybe you're just very confused. How you treat others may not be the way you treat them if it is you're in a normal range of functioning. And so these are things that we look out for, and we can know if it is we're not mentally well. But then we have to ask ourselves this question: what causes mental disorders, right? What causes mental illness? Some persons may say it's genetics, some persons may say it's the environment, and some persons may say it is a brain disorder. Well, all of these three factors collectively actually can account for why persons will have mental disorders. And did you know that mental illnesses, it's not prejudice to your skin color, it's not prejudice to your hair texture, it's not prejudice to your socioeconomic background, it's not prejudice to any of these things. So the moral is that, listen, anybody can have a mental illness. You can have a mental illness, I can have a mental illness, because we don't know what our genetic predispositions are. We don't know, somewhere along the line, it could be an auntie, uncle, sister, brother, great grandparent or somebody who would have had a mental illness. And if it is that they would have had a mental illness, listen, at the end of the day, we all have a touch of something. So we don't know. So maybe we have a genetic predisposition. When we talk about environmental factors, we're talking about stressors, we're talking about home environment, we're talking about trauma, we're talking about loss, grief. A lot of things could happen in our environment that actually influence or just triggers a mental illness or a mental disorder to emerge. Maybe it's something neurological, maybe it's the wiring of the brain, right? So all of these things would or can impact whether or not you have a mental disorder. Now, there are many different classifications of mental disorders, and these are just a few. So I'm not sure, but some of you may know what schizophrenia is. Do we know? Do we have an idea of how schizophrenia will present? Do you know anybody who has schizophrenia? Have you ever heard the terminology? So let me hear from you, please. Schizophrenia, what do you think that one is? Schizophrenia. All right, let's go to the chat and I'll randomly call on persons. All right, Colleen, could I hear from you? Schizophrenia, do you know what that is? Have you ever heard the term before? All right, Joshua is saying that you experience delusions and hallucination, pretty much. Very good. So it would come under like the psychotic category. Okay, major depression is also another category. Bipolar disorder is another category, right? According to the DSM-5, great. Anxiety disorder, substance use disorders, it could be organic disorders, personality disorders. So there are many disorders that comes about. All right, so many illnesses are there. And today we're going to spend some time, however, and try to understand a little bit more about depression. Now, in Jamaica, persons between the ages of 15 and 34 years, based on research, recent research, they're saying that persons between these age group, they're amongst the highest of your overall prevalence of depression. So that means you fall into this category, I fall into this category, right? So it means that there's a high prevalence, and given the COVID-19 pandemic, we're seeing a spike in the number of persons who are having this presentation of depression. 25% of Jamaican adolescents, that's between 13 and 17, have actually reported that they have considered suicide, right? And 18% actually attempted suicide. And this is not an unusual phenomenon. That's 18% too much. So it is a major concern. But do we understand what depression is? Depression is a mood disorder, and it causes a persistence of just feelings of sadness, a loss of interest in probably things that you once enjoyed. It's also called major depressive disorders, but there are different types of mood disorders. Just bear that in mind. Now, depression affects how we feel, how we think, how we behave, and it may lead to a variety of emotional and physical problems. According to the DSM, though, you're going to say, so how do I know if I'm depressed? And we tend to use this terminology very loosely. Something happens and you're like, oh my God, I'm depressed, right? But it doesn't necessarily mean you actually fit the criteria for a diagnosis of depression. You may be having symptoms of depression, but you may not necessarily fit that diagnosis. In order for you to meet that diagnosis, it means that you have to present with at least 5 of the symptoms of depression, with one of the main symptoms being loss of interest in things or just depressive symptoms, right? Just feeling of sadness and so forth. So these are some of the common signs of depression in men and in women, right? So aches and pains and cramps and just digestive problems. You may have loss of interest in activities that person used to enjoy, including sex, including just going out with friends, including just things that once brought you joy. You may have concentration difficulties. You may realize that you're studying, but you can't retain anything. Teacher is talking, but you're not able to really focus and pay attention and put the information in your long-term memory. Maybe you're having sleeping challenges. Maybe you're sleeping too little, or maybe you're sleeping too much. Maybe it's a case you're eating too much or you're eating too little, right? So also, what is a common symptom is just thinking about committing suicide, right? Or just attempting suicide. And a lot of time persons may have suicidal ideation. They may not know where to turn. And sometimes we're looking in and say, how can a person take their life? That's crazy. I'd never do that. But then just like how a person, when they're physically unwell, they'll have symptoms and it will hinder their abilities to do things they would normally do. When a person is not mentally well, it will affect their abilities to think and reason as a normal person would in terms of the normal range of functioning. All right, so that's something to bear in mind. They may also experience feelings of guilt, worthlessness, helplessness, hopelessness, and just being very pessimistic. Now, what role does stress play in mental health conditions? Everybody is stressed. What are some things that are stressing you out currently? Let me hear from you. Right? So what are some of the things that you're currently encountering as students at the University of West Indies? What are things that are stressing you out now? Because everybody encounters stress. Stress can be good, it can be bad. So what are some symptoms, or what are some things that are stressing you out? Or is it that I should assume that everybody is well and nobody's feeling any form of stress? Let me hear from you, please.
Assignments.
Assignments, all right. What else? Exams, great. What else? Just those things stressing you out? Then life is good, man. Life is good. You just have to study for your exam, group work. All right, great. So there are a lot of things. So we encounter day-to-day hassles, whether it is like you're trying to go somewhere, you're late, somebody upset you. So day-to-day hassles, it's a part of life. We will all encounter stress. Now, how can stress then impact mental health conditions? What are your thoughts? Let me hear from you, please. Why do you think stress actually impacts mental health conditions? Because we all encounter stress in this life. We can't avoid stress. So, I mean, how does it impact? What are your thoughts? What do you think happens? Don't be shy. All right, let me hear from Jolene. Or Jolene, did I say it right? All right. Joshua. Nobody's talking to me. Can I hear from persons, please? Are you always this quiet? What role do you think stress play in mental health conditions? What's your theory? All right. Okay. All right, persons are unable to open their mics. Guys, I feel like I'm talking to myself if I don't hear you. You know, I feel alone here. So
All
let
right.
me hear from you.
Miss
Yes?
Passard, so Jolene said imbalance in hormones.
All
Um,
right. Mm-hmm.
she was saying that she was unable to open her mic, so she typed it. I was
Okay.
also saying that it can be a driving factor behind certain actions, be it whether it's good or bad. That's
Mhm.
negative or positive.
Okay.
That's all in the chat so far.
Okay.
Anyone else?
Yes, let me hear your voices. I want to hear from you. Kabo, what's our theory? How can stress actually play a role in mental health conditions? So stress, as you rightly said, it can be good, it can be bad. So if it is, we have some amount of stress, it can actually motivate us to excel and to study and to do what we're supposed to do. But too much stress, it can become very chronic and it can impact our physical health as well as our mental health. And that is why it's important for us to be able to manage our level of stress. Now, according to the DIATHESIS-STRESS model, this model helps us to understand how stress actually plays a role in persons having mental illnesses. So this model explains that people develop a psychological disorder in response to stress because they have an underlying predisposition to the disease. So this underlying vulnerability, we call it the diathesis. It comes from genetics, it could come from biological factors, it could come from environmental factors. So it's saying that you have a vulnerability, right? And then there are environmental stresses that actually interact with your vulnerability, and that triggers a psychological disorder in a person. So in this theory, neither the predisposition nor stress alone can actually trigger mental illness. So they're saying that just being stressed alone, that's not the only thing that will trigger the mental illness. Most times we have to have a predisposition. Or it could be a case where there's a diathesis, something that we are vulnerable to, and then we compound that with stress. And that is what really triggers a mental illness. So the more vulnerable a person is, the lower his or her threshold is, and the less stress it takes to trigger them. So no two persons are alike. We all have different life experiences. So your life is not the same as somebody else's life. So two persons, sorry about that. So two persons could go through the same stressful situation, but then the two of you emerge very differently. Why is it that both of us experience the same stressful event, but then one has a mental illness and one is functioning okay? It could be because of the diathesis, whatever vulnerability you would have had before, compounded with the stressful life event, it would have been the cause or the trigger of a mental illness. And it's just like a case where you keep putting things in, we're putting things in our unconscious, we're putting things in, we're not dealing with them. And then those things make us more vulnerable, and it impairs our ability to adequately deal with a stressful event. And so it triggers that mental illness. So because the level of diathesis and resilience vary from person to person, people vary in how they respond. So no two people will respond to a situation in the same way. So both of us could have been held up at gunpoint. One person emerges okay, the other person is traumatized, and they're having PTSD, post-traumatic stress disorder. Another person, it could be just standing in front of a crowd, and then you realize they're having like a panic attack. So everybody is different, and our diathesis, our vulnerabilities, it may be different based on our genetic factors. We don't know in our family line what we have. We don't know based on the biological factors that are around. Maybe sometimes in our childhood we would have experienced some other deprivations. Maybe it's just childhood experiences where we just experienced trauma, right? Or just socialization. Various things in our environment would have impacted us. So you and I are different individuals. Our life experiences would have shaped us and molded us. And each one of us have our own different vulnerabilities. So it takes a different level of stress to actually trigger a mental illness. So the diathesis, or the vulnerability to a psychological disorder, it would just be there lying quietly until you encounter stress. So the right amount, and I'm using right amount loosely, but the right amount of stress can trigger mental illnesses in any one of us, because we don't know what our diathesis is, right? So part of the theory is that everyone has a certain level of vulnerability and a certain threshold for stress. And based on your threshold, remember your threshold and mine may be different. And the more vulnerable you are, the lower your threshold and the more likely you are to have a mental illness. And so that is why it's important for you to take care, just like how you take care of your physical body, we have to ensure that we do things to take care of our minds and our mental health just the same, because we don't know what our vulnerabilities are and we don't know what our threshold is. So maybe you went through one stressful event, you emerged okay, but then life is always going to be throwing stressful things at you. So what are your coping strategies? How do you cope? Persons highlighted before that exam is stressful, you know, a lot is going on currently, probably it's assignments, maybe it's relationship, maybe it's financial concerns, but everybody has stressful life events. And so because of that, we have to come up with different coping strategies. All right. Now, how do we know if a person is mentally ill? How do we know if a person has depression? How do we screen for these things? So as a clinical psychologist, there are specific tools that we utilize to diagnose persons who have mental illnesses. So we can't just get up and say, oh, she's stressed, or oh, she's depressed, or she has schizophrenia just because, right? So we utilize the DSM along with other screening tools, along with clinical interview and just getting background information as well before we can actually make a comprehensive diagnosis. So one of the popular screening tools for just general mental health is called the General Health Questionnaire, and it is a self-report screening tool for identifying short-term, non-psychotic, and minor mental health problems. So it's a screening tool and it's for adults, so it's not for children, but the focus or the main focus of this screening tool is just looking at difficulties that you encounter in carrying out everyday just your everyday life, or just assessing your normal functioning. So we'll ask you a series of questions, and based on how you answer those questions, we can determine what range you are at. There's also another screening tool called Patient Health Questionnaire, and it is a short self-report screening tool that is used to assess depression severity in both the clinical and the community setting. It's just 9 questions, and it is specifically based on the DSM-5 criteria, and it is used to screen for depressive symptoms in individuals. So these are some of the questions that are on the screening tool. So based on your score, it will tell us whether or not you have depression, you have high depressive symptoms, or just the range at which you fall based on each category. Then very popular, this is a popular screening tool that is utilized, is the Beck Depression Inventory, and it is widely used across the world. It is very reliable, and it consists of 21 questions, and persons 13 to 80 years could actually complete this screening tool. And so it would take persons like 10 minutes to complete. So you're asked a series of questions in the different categories. You realize sadness, just feeling discouraged about the future, feelings of failure, dissatisfaction, feeling of guilt, feeling punished, disappointed in self, critical of self, suicidal ideations, crying, irritability, loss of interest in people. So all of these things, we would ask you these questions, and you'll get a score from 0 to 3. And then based for each item, it's 0 to 3, and then we total your score. And scores that are 1 to 10, right? Those persons are considered to be in the normal range of functioning. Persons 11 to 16, they're mild. 17 to 20, borderline clinical depression. Scores 21 to 30, moderate depression. 31 to 40, severe depression. And scores higher than 40 would be considered as extreme depression. Now, there are other tools that exist to screen for mental health concerns. For example, for screening for anxiety, this screening tool is called Generalized Anxiety Disorder Scale. And again, it's a 7-question tool, so very short questions, and it will really assess based on your score, again, where you fall. There's also the Brief Psychiatric Rating Scale. This is used to assess like symptoms of schizophrenia or other psychotic disorders. There's also Vanderbilt Questionnaire, Connors Questionnaire, that's used to assess if persons have ADHD. There's also other tools that exist for depression, PTSD, as well as anxiety. Screening tools also exist for just general mental health screening, and I'm just going through them really quickly because there are like thousands of screening tools, right? So these are just some very popular ones, and I'm just letting you know that there are several that we use as clinical psychologists, but it's not just the screening tool alone that we utilize. We have to do different things to really come up with a comprehensive diagnosis of a person. All right, so this is a general mental health screening tool as well. So these are some of the questions. It's not all of the questions, right? But just answering these questions can give the clinician a better understanding of your overall mental health. And with that being said, this is where I end. And if you have any questions, you can ask your questions now. Any questions based on what was presented? Anything, depression, mental health, the screening tools, anything. Was it all clear? Anything you want to know?
Question. At what point in time do I need to realize that something is really wrong and I need to seek treatment? Or at what point?
All right. If it is, you realize it's affecting your functioning. So functioning means that you're not able to function at school. Functioning meaning that in your everyday life, things you used to be able to do before, you're not able to do it again. So it's affecting. So it has to be a case where it's affecting your functioning. You realize something is off. So a lot of time persons wait until it's too late to seek help. But just like how if you're feeling a little tummy ache, you want to do something really quickly. So there's no real to say, oh, wait until this happens. So there's no specific starting point. If it is, you feel like this is too overwhelming, just like how you can go to the doctor, get medication for things. If it is, you need to speak to somebody. If it is, you need professional help, nothing is wrong with it, because oftentimes, because of the stigma that exists here in Jamaica, persons are not open to getting professional help. But in my opinion, listen, everybody needs professional help. Everybody needs somebody to just be able to help them to think through things when they're not able to think as they normally would. So whenever you feel as if you need the help, right? So those are the persons who tend to have the better prognosis in therapy, because they feel that need, to get the help.
All right, somebody in the chat also says, so basically no one knows how vulnerable they are.
Correct. You don't know how vulnerable you are. You don't know what's in your family line. You don't know what is your threshold. You don't really know. We are all vulnerable. And that is why when it comes on to stigma and stereotype, listen, it can happen to anybody. It can happen at any time. You don't really know. But there are usually red flags to look out for as it relates to just your functioning. If you realize that you can't concentrate, especially when it comes on to depression, those are the symptoms that you look out for. These symptoms would be presenting themselves like probably over a 2-week period. You realize for 2 weeks, you're just crying excessively. You have no interest in things that you once enjoyed. You just start feeling as if you want to end your life. Your life is hopeless. So those are red flags, and those are indication that, okay, this is not how I normally function. This is not how I normally feel. Something is off. And you usually know that something is off. You're not just functioning as you normally would. It's affecting different areas of your lives.
Okay, thank you.
All right. Okay.
Also, I noticed that you're certified, you're actually a psychologist. Do you take walk-ins, and how do you go about that and stuff? Do you have a private practice?
Okay. All right. So I don't have a private practice currently. I work at the Shelley and Fraser Assessment Center at the University of Technology, Jamaica. It's for everybody. It's the general public. It is a very affordable rate in comparison to a private practice. So I tend to offer my service in that regards, because I know that not everybody can afford a private rate. So I offer my service there at the Shelley and Fraser Assessment Center. And to make appointments, you just call the center, and I'll make arrangement. It can be virtually, it could just be physically, depending. But because of COVID, we have opted to try to do things more virtually.
Okay, thank you. So is there a number that you would like to share in the chat or so for persons who are interested?
I don't think I know the number out of my head. Just give me a second. All right, just give me a second. Or I'll send your president the email as well as the phone contact and the flyer. Is that okay?
Yes, that works too. Thank you very much.
All right, you're most welcome. All right, no more questions. So thank you so much for having me. I really hope that you learned something and it was beneficial in some way.
All right, Miss Passard, oh my, thank you so much for sharing that creative presentation on mental illness and specifically causes of mental disorders or mental illnesses, the types of mental disorders such as schizophrenia. We also thank you for touching on the statistics surrounding depressions, as well as the theory of diathesis, the diathesis-stress model. That was definitely interesting, and what it entails, as well as some of the screening tools that you guys use in diagnosing individuals, the GHQ, the BDI. We thank you so much for taking the time out to really be here. And we definitely wish you all the best going forward. And trust me, this will not be the last time you're hearing from us. You're definitely a very interactive presenter, and we really appreciate you for that. So please do take care, and we do look forward to hearing from you again. And by extension, thank you guys, our members, for coming out. You're the reason why we keep these meetings. So we look forward to seeing you next week, where we have so much in store for you. Guys, we wish you all the best. For those who are still doing exams, we wish you all the best and good luck, and we'll definitely see you next week. Do take care and enjoy the rest of your day. All right, bye everyone.
Remember to sign the register, please. It closes at 4:30.